evening, everyone. We call our services committee meeting from March 18th order. Is there a motion to approve the agenda? Ms. Curran, seconded by Mr. Smithers. All in favor? Aye. Opposed? Noted due to extenuating circumstances, legislator Sheridan is attending remotely from 828 107th Avenue, Treasure Island, Florida, and Legislator Fay and Legislator Tominelli are excused from the meeting. Is there a motion to approve the minutes for this evening for February 12th? Mr. Webster, seconded by Mr. Perkins. Curran, all in favor?
Aye.
Any opposed? Approved. First, we have resolutions from community services, and we have Ms. Best here this evening. Welcome. Our resolution under community services is authorizing the chair to sign a contract with Coordinated Care Services Incorporated for the preparation of the 2023 consolidated fiscal report and modifying the 2024 budget for community services. Is there a motion? Mr. Smithers, seconded by Mr. Jeanette and Ms. Curran. Go ahead.
Thank you. So CCSI has consistently prepared our CFRs, which are reporting for state aid since 2021, and provided technical assistance to our fiscal staff doing that. We are currently without a fiscal staff for the LGU. I'm actually currently taking that on. So we're looking for the continued support from CCSI. I'm bumping this up to 20,000, not to exceed 20,000, but it will be billed at an hourly rate.
Any questions or discussion on the resolution? And just to clarify, Lindsay, this is it's a $20,000 budget billed hourly up to that amount. So if they complete the report, it only takes fewer hours. We don't spend the full one. Is that right?
Correct.
Okay. All in favor?
Aye.
Any opposed? Next, we have some statistics updates.
So we have revamped this monthly report. So the changes from last month and what you are consistently have been seeing is we've removed some items that we didn't think were as relevant, and hopefully have provided some more information that we feel is relevant. So on this first page, we have removed the no-show rates because those were quite stagnant consistently across the last 6 months. We also removed the addiction services, OTP visits, and mental health visits for 7 hours, as those really were reflected in some of the other data that we were sharing. So this very first graph that you will see is the monthly clinic counselor visits. We did add a 6-month average on there. And what we'll be doing is reporting the change from the previous month to what this month is. So for the last report, the average of the clinic visits was 72%. Last month was 65%. So we are seeing an increase overall from the previous month's report. The next two are the addiction services and OTP face-to-face percentage, as well as the mental health face-to-face percentage. You will see a pretty significant jump in the February numbers. That is attributed to an increase in attendance to our groups, to our individual appointments, as well as our jail visits. So we have an addictions counselor within the jail, and it's a pretty captive audience, and they're attending the individual sessions. So that's what that number, that jump in that percentage is attributed to. Same thing on the prescriber visits for 7 hours. That's a jump there. We did verify that those numbers were accurate. We took the waiting list, that one remained the same. Again, that one individual that is listed for the OTP, they are in services with us. They're seeing a counselor, they're seeing nursing staff, they're just waiting to receive the medication from the OTP. So that higher level of care doesn't need it, but they are currently in services with us. The next page, the services provided by all clinics. We did add the caveat that does not include the OTP medication dispensing. If we had included that, we would be well over the average of 2,000 a month. So we did put that in there as well. On the next chart, the opioid treatment program population source, from previous charts, or previous monthly reports, we had listed other. We have changed that to outside sources. I didn't like the other, or we didn't like the other. Didn't think they gave a good representation. Outside sources could be an individual themselves, another clinic, hospital, not us. So we did change that. Previously we did, we had a chart in here in our monthly report that had the change in census for the OTP. So it would show you the admissions for the month or over the 6-month period, and then the discharges over that 6-month period. What we've done is actually included what the OTP census is each month, and I apologize, when we did this chart, we didn't include the labels. So for the month of September, we had 169 individuals enrolled in the OTP. October was 170, November was 172, December was 170, January 176, and February 170. And what we can do is also put the average, but we're staying pretty consistently around that 170 mark for OTP. Moving into probably the biggest update, but hopefully will help alleviate some questions that we always have surrounding our billing. So what we did, this very next chart is a brand new chart. So it's reimbursement rate. So this is an update of what was previously, what we had been previously sharing with all of the rebills removed from the growth charges. So obviously there's a 3-month lag. So this out of the bills that we're sending out, say in June of 23, that's the percentage that we're receiving back. Again, it's not apples to apples, so it's not the January, or sorry, the June bills. This is what we're receiving for June. So we billed for the month of June. This is the percentage of less denials that we're getting back.
Interrupt,
Yes.
just to clarify. For example, if we billed $100 and this says 91%, that means we were paid $91 just as, so this is in dollars to dollars.
Dollars to dollars, yes, yes. And then what we did was we broke it down for each clinic. So you can see the dollars that were billed out in a month and the dollars that we received for that month. What we have fixed as far as, you know, the denials that we're receiving with these rebills, so telehealth modifiers. Our system did not have, in the back end, did not have it set up for telehealth services. So that's a specific modifier that gets sent to the insurance company that we fixed. So we're able to receive payment for those telehealth services that we're providing. One of our prescribers on the mental health side was not credentialed properly. We have fixed that. That was a huge chunk, especially on Medicare on the mental health side of things. Our APG rates were not set up properly on the mental health side. Those have all been fixed in line with the APGs. Same thing for the OTP and the addiction services. We fixed the telehealth modifiers on each of those. And then also on the OTP side of things, our system was not built up for us to build take-home medications. So when an individual is receiving services from the OTP and they're doing better, they get take-home medications. And we had not been billing correctly or billing at all for some of the methadone take-home medications. So that has been discovered, fixed. We're already seeing a pretty significant change from that. I will tell you, I ran the numbers really quickly, just from our holding account. So looking at what's coming in from insurance companies electronically. So if I looked at Q1 of 2023 compared to up to March 13th of this year, we're already seeing about a $250,000 increase in revenue from insurances. So we're on track to do much better than what we have been in the past.
Mr. Smith.
Well, Lindsay, this is really amazing, surprising, and somebody's done a lot of work. This is exactly what we were looking for. So thank you for this. And it's encouraging for us. We had some concerns about these reimbursement rates, and to see once you've removed the rebills, that looks a whole lot better. than the 40% or so that we were looking at before. So thank you for that.
It's not just the media, it's the whole department. A couple,
Somebody's done a lot of work.
Mr. Lightfoot.
I would echo what Mr. Smithers just said. Obviously, it's been a great effort because by the looks of things, the return is great and significant. And I hope it continues and even improves. And I'm sure that's on your list of things to do, is to continue to improve it. One of the questions I had has to do with the notes of the rebuild claims removed. I understand why rebuild claims are removed, but we are still pursuing that money that has been billed that we haven't received. And I assume that part of that is correcting whatever it is that they say is missing or wrong with the claim itself. Is it safe to assume that my looking at these two graphs here, and it doesn't make any difference which one, well, let's just take the first one for the OTP, $112,472 billed, 92,900 received. Do the rebuild items equal the difference between the two of those? Or where are those monies?
So I don't know, we can't look at this because it's not month to month, right?
That's
So,
correct. I understand.
what we would have to do is look at the denials that we have and what that visit type was that was billed, to get the actual dollar amount. That's a huge lift, to actually.
And I understand that's nigh unto impossible.
Yeah,
Not,
so when I talked about the things that we had fixed, like the APG rates, the telehealth, those are the things, those are the denials that we're getting. And those are the things that were being rebuilt, right? So those take research, and when we find out what it is, that's what gets fixed. And hopefully what you'll see is that the money's trending upward, and the gap getting smaller.
mhm.
I mean, I think it's fair to say that some of the denials are in the difference, but there's obviously some in there that we'll never get back. But to assign a dollar amount, I mean, that would take some more research.
Okay. But absent defining what the dollar amount is it safe to assume that those are monies that were billed originally, but have been denied for one reason or another?
Yeah.
Okay, so we could figure a percentage out then, okay, all right. Thank you very much. And that is nice to see, it really is.
And Mr. Light, to your question, I believe, Lindsay, there was a discussion about a portion of the report. It's not here, but I think you're working on it, which, if you have monies received and monies billed the first time, initial bills, that's what we're looking at, that ratio. Like, to your point, that the rebill amount where the amount of, dollars represented in what we're rebilling, you're billing a second time or third time each month, that's still important. It's not like it doesn't exist anymore because we took it out of that ratio. So to your point, they're gonna include something to show that amount, how many dollars worth are we rebilling each month? And so we can track that, because that.
And that's why I wanted to know,
Yep.
is the difference in what we billed and what we received, does that difference equal the amount that we are rebilling for? I mean, and maybe it would affect what we would get. If it were a billing error in attaching whatever was billed to a certain reimbursement, so I can understand it might be different, but that in and of itself ought to be pretty close.
Yeah, and we'll have another chart on here next month that should be flipped over.
Thank you very much.
Mr. Forsythe, do you have your numbers?
Very nice, looks good. Two things, you mentioned the inmate population as far as the prescriber visit 7 hours. Is that like, they go into the jail and do like groups or something? Is that why it's pushed up so much higher?
Yep.
And did that just start or has it been
It's been going on, but, I don't think they were always well attended. I know the counselor that's in the jail is really pushing to make sure that folks that are incarcerated are attending more frequently. So we have also increased a day. Our counselor, is increasing the time that they're spending in jail as well.
Now, are those reimbursement visits?
No,
So
so
that's just for
Yep.
gratis, but it helps to build up.
we do get state aid, for those jail services.
Okay,
160,000 in state aid for those jail services.
okay. Okay. I had another question, but I can't think what it is. Wait a second. But I'm all set. They'll come. It's one.
Mr. Reagan.
Lindsay, thank you for, and thank your staff for what you accomplished and are accomplishing, and I think it's wonderful. I think it's shocking that we used to employ a company that was supposed to do the correct kind of billing, and I could be wrong, but it's become clear to me that maybe they really didn't have a clue what they were doing. You know, it shouldn't have been that years and years later, these kinds of adjustments are now being done and weren't being done for many, many years. But I think it speaks to a broader problem. And, you know, the fact that you don't have a fiscal officer is a sad commentary on county government. And the reality of the little value that this board places on providing competent fiscal management on multi-million-dollar departments. And then we're constantly surprised that we have departments where we don't have a handle on their finances. And I think it's a direct result of the fact that we do not provide salaries for our fiscal people who are overseeing multi-million-dollar budgets, and make sure that they have both the knowledge that they need to do that. And I would hope that at some point we will talk to the county treasurer, and because I believe that there are other problems in, you know, and that we are headed for additional problems. And I know there are people who don't agree with me and don't want to hear this, but when you don't have people able to provide fiscal oversight in the departments, fiscal problems occur. So this is not your fault. This is the fault of the people in this room, not yours. So, you know, I know I'm a broken record on this subject, and I will continue to be one. But, you know, when you've got a $250 million budget, somebody needs to mind the books.
Ms. Lipper, you were next.
It's good to see this going in the right direction. You guys are doing a great job. My only question is it possible for you to do a graph or a statement that shows monthly how much was billed, how much was collected? And then instead of, you know, and also break it out what was rebilled and what was collected from that. So we can actually get an accurate statement of what's being billed and what's being paid.
So there's insurance companies for contracts have 3 months to pay us. So to put, you know, this is what we billed in June, this is what we received in June. I don't think we're ever gonna get to there. I think this is probably the closest that we're going to get. In addition, we'll have the rebuild chart for you next month, so hopefully maybe that will help a little bit.
Sounds like it could all overlap 3 months, but every month is gonna overlap 3 months. At the end of the year, you're gonna get a running total. And you could also have a chart with a running total for the whole year. So we could see what's being billed in January, what's being collected. Now, I understand it might take 3 months to collect, but then what's being billed in February and what's being collected. And
So,
then you-
right, so instead of 6 months, you want the whole entire year?
That's what I'm saying, you can do 6 months at a time, but monthly too, so we're actually getting apples to apples, and oranges to oranges. We're getting clearer statements by the month. This is what was billed, this was collected, I understand it might take 3 months to collect that, but you're also gonna be getting 2 months before that going into that too, so it's gonna be a more clearer picture.
Yeah, what you're describing, I think would be a report purely based on date of service. So if we perform the service in June, we want to know how much were we paid for that service? And you want the payment to hit in June, even if we were paid 3 months later. That's kind of what you're describing, like.
Even if it's what's billed in that month. And then if we don't get paid 3 months later to it, it's okay, because it will show we got paid 3 months. But 2 months earlier, you're billing something that's gonna get paid that month too. It's all gonna end up basically averaging out monthly, you know what I mean?
So we've tried in our EHR, we've actually asked them, you know, is there a way to, this is what we billed in June, this is what we were paid for those June visits. They're telling us that there's no report function to actually see that. So,
They also told us this wasn't possible. We figured it
well, we
out.
figured it out, however, yeah. So I mean, we can certainly take it back to the drawing table, I mean, and look, and see if we can.
If worse comes to worse, you could set somebody down on the computer and say, this month we billed out this many dollars. This month we got paid this many dollars. And then the following month is the same thing. You would get a running total month by month of what's being billed, what's being collected. And they're saying, well, it might take 3 months to get to 2 months to get that. But don't forget, there's 2 months before that that's going into that too. So it might move a little bit, but you're gonna get an accurate reading as it goes on. The longer it goes, the more accurate it's gonna be.
I get that, but I'm gonna be completely frank and honest, we don't have the staff right now to do that.
Yeah, the extra component for next month might fill in, and if we want, thankfully, you know, this is a sort of a first time we're seeing this new design of the report. So I think the team will refine it month to month. But that, what you're describing, Mr. Redford, is a typical medical billing report feature. If you're looking at a whole suite of reports, that you'd expect that pure billing date report to be part of an EMR's suite, but it's not part of ours. So there may be a way to back into it when we have the right resources for sure. We had Mr. Burke had a hand up.
To just echo what Harry and Joe and everybody else has said. Great job, very impressive. I did have a question. You said who's we?
Sarah McGregor, our mental health program director, and I.
Just to know who to give credit for. Again, very impressive. Correctional facility services provided to our correctional facility. If we didn't do that, even though we're not paid, somebody would have to do that, and that would be a direct cost. So again, it's a little bit, a little bit ambiguous, but we're saving taxpayer dollars by doing that. The other thing I wanted to ask is the OTP. When you say opioid treatment program, does that include Suboxone, or is that strictly the method?
It's both.
It's both.
It's a whole. Yeah. So when they need, it's a level of care. So OTP is a level of care, and the medication that they receive in that level of care could be the Suboxone or the methadone. What the difference is, they're getting dispensed daily, right? So if they were in our regular addiction clinic, they would be getting a prescription that they would fill up at the pharmacy. this, we're actually dispensing the medication.
Do you know ballpark, or maybe we have?
I want to say it was around 70.
Thank you.
That's correct.
Hi, so when we bill, do we not have an invoice number anymore? Like, we billed for June, it's invoice number 06-2024. Week one, you know what I mean? Like, is there no signed identification number that when people send you money, there's like a little, this is where it gets applied?
So we build everything electronically through a clearinghouse. So there are, it's a claim ID is attached to it. Not an invoice number, but a claim.
So if we know that claim ID is specific to June of 2023, should we not be able to pull that out in some way?
So when we receive reimbursement, it's for a whole host of claim IDs that are all put together, so it would be a lift.
Gotcha. All right, thank you.
Mr. Zegger, do you have your hand up?
I did.
Floor is yours.
Lindsay stole my thunder. I was gonna ask, what would these people be doing? This is excellent, but what would they be doing? Sitting there and doing this. It's taking manpower, woman power, people power to put these numbers together. So, I'm curious what we're taking them away from. I don't want this to go away.
So it's the mental health program director and myself that are working on this, so all of our other duties.
All of your.
Thanks, Mr. Ray.
And what's your, degree in?
So I have a bachelor's in criminal justice, sociology, and psychology.
Would it be helpful if you had a fiscal man?
Yeah, 100%.
Just to make it like more worse, could we get a monthly breakdown on the methadone versus the other drug that they're on?
Yeah, we already pulled that data
If
from.
we could just have that as a monthly, just to make your life further complicated, but I believe that you ought to have a fiscal manager, and we ought to have fiscal managers that are interested in being long-term people in these departments. And rather than beating up on our department heads and assistant department heads to solve financial issues, first we ought to give them the kinds of fiscal as experts who can help accomplish these things. Thank you.
Legislator Jeanette.
I just had a question. So you said you're using Power BI. And with those data sets in the Power BI user, you can't pull those records that she wanted. I'm not sure how they come. Are they just like social security numbers, or what do you? Because you're going to pull each data set to make whatever graphs you're doing. So I was just wondering, when you go scrub it, right? You can pull those charts or no?
So in Power BI, no, Power BI is just the financials. I would have to like get in there and look and see if we could scrub claim IDs. I mean, realistically, all of the stuff in Power BI that has been accomplished so far has been our mental health program director, learning it. So, I mean.
Yeah, that's, I had that all through morning with Power BI, so that's why I was just like curious on.
To your point, Mr. Jeanette, I had a quick window into the Power BI setup that they have. From what my understanding is, data sets that are available are relatively, they're sort of pre-prepared data sets out of the EMR. They're not a core look into the whole backend. So there are data sets that the EMR builds their reports on that we have access to that are sort of set up for analysis in Power BI. Whereas if we don't, it's not like we have the full program-wide, server access to the.
Where's the input then?
Data set.
Just straight,
From our EHR.
just go back. Got it.
Who else had their hand up? Mr. Webster.
Now, the legislator, this question, you said it's hard to tell where it went or what it goes to because it sounds like it comes in one big check with a bunch of numbers. And you must have to apply those dollar amounts to those numbers to pay those bills.
So when the money comes into our holding account, it comes in with a check with one lump sum with a check number and a reference number. So what then one of our account clerks, our only account clerk does is takes that full check number, then goes to the explanation of benefits for that insurance company and goes one by one of determining which claim got paid and then assigning it to the direct clinic.
But it must be assigned to that particular number to pay that bill up, right?
So that's done in the electronic health record behind the scenes. She's just taking the lump sum. So behind the scenes in the electronic health record, that's getting credited to the patient's ledger automatically when we do auto posting. What happens then is we have to go into the holding account, look at that lump sum, the check, and then the EOB, and decipher which clinic, whether it's OTP, mental health, or addictions clinic, which addictions clinic, Ogdensburg or Canton PRU, to then be able to do the journal entry to move the money to the correct revenue.
Is it my turn yet?
Yes, I'm sorry. How are you, Mr. Lightfoot?
I take issue with what my fellow legislator brought up earlier, that it's this board's fault that we don't have fiscal managers in all of the departments. The real reason is that when we are looking for competent and qualified fiscal managers, we don't have any applicants. None. Am I correct in that, County Administrator? Is that a historically correct
None is
assumption?
probably an overstatement, but very few. Very few.
That's correct. In
And
fact,
long
it did give pause to a couple of our professionals, the thought of switching jobs from where they are working now. Is that not correct?
In terms of our efforts to hire, yes.
Exactly.
Yes.
Okay, so the problem is that there's not a lot of qualified people out there that want to come to work for St. Lawrence County. I don't know what a qualified fiscal person is expecting or should expect, or what we offer to fill that position. But I got to tell you, I for one, and I'm sure the rest of this board, if qualified people in the fiscal realm applied for a position here, they wouldn't get short shrift. They would get a good looking at, and if they were qualified, they'd get hired. And there's a salary schedule there that tells, what it is. Like I said, I don't know what it is. Is it too small? I don't know. Is it too large? Probably not. But the fact remains is, I think to throw something like that out there is a little irresponsible when you're accusing this board of not doing its job. And this board does do its job. Take a look at the fiscal issues that surround us now that we didn't have, or we had several years ago, that were taken care of and well taken care of. So I really resent that type of a comment, and I don't think too much of it. Thank you.
Thank you, Mr. Forsythe. Try again. There you go.
Thank you, Mr. Chair. Lindsay, how many people have the ability to do that last part you just told me about? Taking the bundle and dividing it up wherever the monies go. How many people do that? How many people do we have in reserve?
Maybe one other.
So that's
that
the
we have to
issue.
train.
Right? That, to me, that's a serious issue, right?
Yes.
When that one person's out, we don't get it, right? So how do we fix that? What's
We
the
are
suggestion
working.
for how do we fix it?
Yeah, so we are working, we recognize that that's 100% an issue that we have seen over the last few months, that if we lose an employee, there was no one that knew what they did. So, yes, so we are making sure additional folks are trained. We did just hire a senior fiscal officer that is going to be helping with the billing, or not, I don't want to say the billing, but the moving of the money. So she is actually has been working with the account clerk already to get trained on the holding account. She's helping us with some of our grant fiscal activities right now, because those are huge and important, because you know, we have federal grants that
Sure.
we're recording it. But we absolutely recognize the need to cross train. We will be doing that going forward, and already are starting.
That makes me feel.
Legislator Hagan.
I guess either Lindsay or Mrs. Doyle. Do you ever get the feedback that I'd love to come here, but the salary's too low, or I can get more somewhere else? Is that an issue?
We have faced that and had some talented folks who were able to utilize our salaries to increase the pay at their current position, so then they don't depart. So they decline based on, you know, we're all pulling from the same group in many situations, and they'll utilize the salary we offer in some situations to have matched and stay right where they are. And then those places sometimes also offer remote working opportunities, so becomes immediately more attractive than what we have to offer.
Thank you.
Mr. Jeanette, could you deactivate your microphone? And Mr. Reagan.
This is to the county administrator. Do you think, you know, the statement's been made that, no one wants to be, to work for county government in the fiscal areas. Do you think it's possible that there could be a way for us to attract candidates?
I do.
If could at some point, you and the county treasurer offer us some suggestions on ways we might actually accomplish such a thing?
We would be happy to.
That would be something that I would like to ask the board to consider bringing up at our next finance meeting, because I think that the county treasurer might have some eye-opening thoughts for us, as well as the county administrator, about our long-term situation if we don't start taking this issue seriously, and instead of being defensive about it, try to be proactive about seeing what can be done to help make sure that we have proper fiscal oversight of $250 million budget. Thank you.
Is there any other discussion on the support from community services? Okay,
Can I give my update?
absolutely, knock yourself out.
So I do have one last update on the Medicare application.
It's not on the list.
It's not on the list. It's not on the list. Yeah. Very optimistic and hopeful for this. So application had been submitted. We had to do some follow-up. We received a notice in the mail, or actually electronically, that says we can expect an unannounced visit to make sure we are operational. So to me, we have not received that to date. So that says to me that fingers crossed, toes crossed, that we are at the very end stages of getting our approval for Medicare.
And for those who may not recall, that was a condition of us getting the gates of the flood persuasion open toward revenue coming in for the OTP. Thank you, Lindsay.
Thank you so much. Next, move on to public health. So you can come on up. Our first public health resolution is the approval of rates for related services for the preschool special education program. Is there a motion? Seconded by Ms. Curran. Kylie, whenever you're ready.
Thank you, Mr. Chair. So this resolution is one of our annual resolutions, looking forward to approve the rates. These are rates that are set by New York State. The rates have remained the same from last year. The last time there was a rate increase was in 2022, and there was an 11%.
Is there any discussion, Ms. Haggard?
You might not be able to answer this because you said the rates are set. But I'm just curious why it's in here. It's more than the teacher visual. And just curious. Thank you.
Any other discussion? All in favor?
Aye.
Any opposed? Carried. Our next resolution is authorizing the chair to sign contracts for services for the preschool special education program in the public health department. Is there a motion? Mr. Jeanette, seconded by Mr. Curran.
This is another one of our annual resolutions for the EI program. To be able to put a contract.
Any discussion? All in favor?
Aye.
Any opposed?
Aye.
Carried. The next resolution is proclaiming April 1st through 7th as National Public Health Week with the 2024 theme of protecting, connecting, and thriving. We are all public health. Is there a motion? Ms. Curran, second by Ms. Perkins and Mr. Jeanette.
So this one, we're just looking to partner with the Board of Legislators, trying to spread awareness about what public health is. This year's theme, that we're all part of public health is really that unified message that we all have a part to play. Some of the items that are involved in this week is civic engagement, helping news reports, schools innovation, share public health, and we'll be putting lots of social media posts around that. We're working with our partners.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed?
Aye.
Next resolution is modifying the 2024 budget for public health for funding received from community services for the Oasis opioid settlement funds. Mr. Jeanette, second by Ms. Curran.
So this one, we're looking just to receive in some funds from community services to continue our work on opioids, poisoning or opioid overdose. So we're hoping to use some of the funding for some salaries for our staff, for some harm reduction kits, messaging, as well as educational materials. We work very closely with community services and Seaway Valley Prevention Council to make some resource guides, and we get lots of questions asking about them, so we're hoping to be able to keep those going.
Discussion.
Thank you, Mr. Chair. This is more for the county administrator though. Okay. Do we have a yearly amount we are taking in opioid settlement money? Have we established what it is yet?
We have a balance of what's been received so far that I can share with you.
Do we have a projection? Do we have a way to project it out?
We do, I believe the treasurer's office is working to close out 23, but they also are looking at what the annual amounts are going to be.
Okay.
We met about 3 weeks ago to look at bringing in all of the revenue we've received so far.
Yep.
And identify, as you may recall, there's restricted and unrestricted areas.
Yep.
To make sure we maximize both, and that will also allow us to decrease overall county cost. So I can share that with you. We have at least where we are to date for what we want to use those funds for.
Would you suggest a committee to look into prioritizing what we utilize that monies for, or just part of the budget process? What do you think?
I think that there are a number of areas that the treasurer, deputy treasurer, and I have come up with. I'd like to share that with you and see if it meets the standard that the board would like to see. And certainly if there's questions, concerns, we certainly want to stay in and around that area of offsetting the increasing costs associated with that to decrease it coming from county funds.
Right.
So we can share that. If there's still questions, I certainly welcome committee input of any kind.
Okay. Yep. Thank you.
Any other discussion? All in favor?
Aye.
Aye.
Our last resolution on the agenda is modifying the 2024 budget for the Public Health Department for epidemiology and laboratory capacity, COVID-19 enhanced detection. Is there a motion? first.
So with this one, we're just looking to catch up our grant funding and our budget modifications for the grant, just with our majority of it was.
So are we mandated by the Department of Health to do this kind of stuff still? This sort of surveillance still?
Yep, it's still reportable.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Here. Anything else, Carolyn? Okay, thank you so much. Next, I'll invite up our Commissioner Seaver, evening, sir, for an update on eligibility. Okay. Very well, whenever you're ready.
Good evening, everybody. Before I start with eligibility, there is one update that I would like to make that I've alluded to in past meetings. As of April 1st, I have sent notification to OCFS that we will be withdrawing from the FAR program for CPS. We've had a lot of conversations about it. There's been a lot of information that we've taken a look at. It is my personal belief that every allegation of abuse needs to be investigated. It does not preclude us from providing wraparound services. It does not preclude us from doing all the same things that a FAR case would have been. But I think the children of St. Lawrence County deserve those investigations to be conducted. So I sent that out, a certified letter today to OCFS to inform them of that decision. So
Is there any discussion, questions? Ms. Kern?
Thank you very much, Mr. Seaver. That's necessary. I agree with that. I feel there was a lot of things that people that took advantage of the FAR advantage versus ending up with more scrutiny. I appreciate that.
Yes, ma'am. Any other discussion?
all right. Well, let's get right into our statistics. I know how much everybody enjoys them. So take a look at our eligibility. On page one, a lot of this stuff really doesn't have a lot of change from month to month in our eligibility. If you take a look, our heat cases stay pretty stable from year to year. Medical assistance cases fluctuate a little bit, but we all stay fairly stable with those types of cases. One thing that, I did notice today, looking at the program applications from the second chart on the second row, those are for our SNAP and TA. They've come down and we can't really find a concrete reason for that. It's just one of those fluctuations that we just can't really put our finger on. Maybe it has something to do with school being back in session or holidays being over. I really can't put my finger on that. Because if you take a look at it historically, that's going to come back up anyway. If you take a look at page 2, I'd like to spend some time talking about the Medicaid applications. I actually want to spend a significant amount of time, if you wouldn't mind. Sorry, Ms. Haggard. So taking a look at that chart on the bottom right, after I met with Ms. Doyle this afternoon, I went back and took a deeper dive into some of our numbers. And I don't think that this chart is sufficient. So if you take a look, we had 46 chronic care applications and 39 community Medicaid. That doesn't tell the whole story about Medicaid applications. That only shows those 2 specific types of applications that we receive here in the county. We also receive hundreds of applications that come through the state portal. So I'll just give you a little bit of information about that. The chronic care applications, we had 46 of those. Those are individuals that need to go into nursing home care or are in need of home personal care. And those were originated here in St. Lawrence County. The 39 community Medicaid applications were all individuals over 65 that had been receiving Medicare that now need to apply for Medicaid. In addition to those applications, though, we received a number of other applications and requests for work on our part through the state portal. And just to share a couple of those, one of them is we call an H2W that comes through. We get those requests. Those are individuals that are active in the New York State of Health portal.
that turn 65, and then once they turn 65, they're required to apply locally instead of going through the state system. The H3W that came through, those are individuals that are active in the New York State Health portal that need local DSS assistance due to a need for personal care. Once people need personal and home care, that has to come back again to the local applications. Since people need to reapply. So we're working on those applications as well. When a person applies on the state portal and are denied, and the issue there is that when somebody applies for Medicaid with the state portal doesn't do spend downs. So it's either you're eligible or you're not eligible. So when somebody is denied, then they have to come back and reapply on the county level. And then when we go through and we take a look at it and say, okay, you're eligible for this much coverage with this much of a spend down to help some people that maybe their income is high enough that they're gonna be denied on the state, but low enough that they still need some assistance. So all of those denials come back through us as well. On top of that, starting in July 2023, we had to recertify everybody else based on some changes in Albany. That month alone, we did over 800 recertifications, and we've been continuing on, not quite at that level, but at a high level every month since. Additionally, the expanded income guidelines that were enacted in 2023 have made many more people eligible. And just a couple of numbers to throw out, and I know that Mr. Hall mentioned this as I did at our last meeting. In November of 2023, 39% of all New York State residents were enrolled in Medicare, as 7.6 million individuals. In March of 2023, the enrolled population breakdown for the state of New York, non-disabled adults were 49% of the enrollees. Non-disabled children were 31% of the enrollees. Individuals 65 years old and up were only 12% of the enrollees in the state of New York. 6% of the enrollees were disabled adults and 2% were disabled children. And the reason I bring in these numbers is to illustrate that Medicaid is exploding. And the chart that we have here that says Medicaid applications doesn't tell the whole story. It looks like it's kind of going down, but those are only those very small county-only applications that we get for that specific niche. So next month, with this bill's approval, I'm not going to have this chart on here. We're gonna make some changes to give you some additional information. What's going on in Medicaid is actually going in the opposite direction. It's every month it seems it's getting more and more. 51% of the population of New York City is currently enrolled in Medicaid. Statewide, this has all been just skyrocketing over the last 2 years. So I wanted to kind of center on that Medicaid applications because I don't think it was really giving you the information that you deserve to have. So I wanted to take some time to touch base on that tonight. So I don't know if anyone has any questions on the Medicaid or before I kind of move on.
Thank you, Mr. Chair. Joe, I agree with you, and that was a concern at my NISAC meeting as well. Illegal immigration. There's roughly 100,000, anywhere from 70 to 100,000 illegally documented people in New York State. Are they entitled to Medicaid? No.
So what legally, no, that's a no, sir. Okay. What people are entitled to, and I made myself know because I thought somebody might ask about that. Okay. So there's two types of assistance that people, when they come, are eligible for. And we have our TANF and our safety types of assistance. To be eligible for TANF as temporary assistance for needy families, you have to be a citizen. You don't qualify for that as you are an alien now. If you come in as a legal alien, come through legal chapters, or a qualified alien, and I'm not even sure what the difference between legal and qualified is, because I don't go to school for it or something, but they can get TANF, but that's a very minute portion of people who are coming through. Now, individuals that are not coming through with that status can receive certain safety net benefits, but they have to be in a situation where they are eligible, would normally be eligible for TA if they were a citizen, but they are not eligible for other federal funding. So again, there's a very small amount of assistance that's truly available to aliens that are coming in illegally. Now what's happened is a lot of the people who come in have been designated as asylum seekers. And I'll be honest, I'm not sure what that means in terms of their status. I do know that additional monies has been allocated through New York City, where the majority of the people have been coming through in the state of New York, to outside of these pots of money to provide assistance for these individuals. But that is not impacting our Medicaid numbers, not yet.
Okay, so if I could follow up. So an individual comes in, come to find out was 7 months along, pregnant, goes into the hospital. Who pays for that?
Taxpayers. The hospital, who runs the hospital would end up floating that bill. It's a public hospital.
So they would soak it up themselves, they provide the service and.
And then bill that individual and hope to receive payment, I would assume.
All right, thank you.
Sir?
Reagan.
So, illegal aliens, is your office seeing any of them coming in seeking assistance from your agency?
We have not yet. We've had 2 individuals show up. One of them was brought to us in the back of a patrol car from Border Patrol. That individual was trying to move through to visit a relative out west, and I had one of my staff deliver that person to the airport to catch a plane. The other individual was with us overnight and moved on to a family member down in the New York City or Philadelphia area. So we're not seeing that here. Yeah.
So you're saying in the past, how many months have we had 2?
I would say since we've been talking about this, it's been what, about 6, 8 months. So we've had two that I'm aware of. It's not something that happens very often.
Could you keep us abreast?
Yes, sir.
So that, because I think that there is a belief and perception that the county is, we have all these illegal aliens settling in the county, and that, we're providing them with social services benefits and all sorts of other services. And, I don't pretend to know anything about it. But what I hear is those that do come through illegally are on their way to somewhere else. And, that doesn't mean they're not going to start staying here, because we all know how wonderful it is here. It would be helpful to the board to be apprised, if a trend, starts, and make us aware of what is occurring as it is occurring.
Absolutely, sir.
Thank you.
Yes, sir.
Commissioner, do you have additional report you want to provide, or that's?
Well, I did want to just, on the last page, to touch up, we talked about Medicaid. The last thing I wanted to talk about Medicaid, because we have here our charts of Medicaid by age, that stays pretty stable. Our breakdown of active Medicaid, SSI versus non-SSI recipients is staying pretty stable. The last thing I want to mention about Medicaid really doesn't have anything to do with those. It's we are in the process now, and have been since these eligibility limits have changed. We're actually having to retrain a lot of our staff that came on during the COVID epidemic, because during COVID, they didn't have to do research. They didn't have to do a lot of these things. It was just not as is. These people came on, they're working, they can take applications, but they don't know how to do all the rest. So now we're bringing on new staff, and we're retraining the ones that we have, and trying to get all this done at the same time. So I just wanted to paint that picture, that regardless of what that chart with the number of applications looks like, our staff are staying there. It is. I think that's all I have for this.
Mr. Burks?
Joe, I didn't notice any reports about hotline reports. Are we not doing that
Well,
anymore?
we normally, that's our services section, what we've been doing for a few months now is, each quarter or each month, we're doing a different report that we usually cover that under our, services. We did that last month. We'll do eligibility this month, and next month we would be doing the finance report.
Maybe I could ask. Re-noticing it.
I can tell you that here we are in March, and as of last Friday, which was the, let's say the 18th, 15th, midway through, we'd already received, somewhere around 120 reports. I will say that the trend I'm seeing is that some of our cases are more, severe. We're seeing more cases with larger families for some reason. We have I have to take 5 kids into custody, over the weekend, Friday and over the weekend. So again, as I think I mentioned before, the cases that we're seeing are more complex and tend to be more severe. And I think part of that, this is my personal anecdotal experience, is that it is related to the drug issues that do not seem to be going.
Just, of all the reports that you do, at least for me. And again, I know that you mentioned, realize that we changed what we're reporting on, but I think what's happening.
If the board would like me to report on that every month, we can.
So the staff continue as a, into a very good routine, and as staff have departed and then transferred that responsibility, the report is still compiled, and you can find the full report in the board share. It's just those reports, I think to some legislators' concern, took a long time to get through all 3 areas, and so that's why we broke it out for the quarter. And we're reporting the finances after we report the quarterly reports. That'll be next month. But that report is still gathered every month, and you can still access it on the board share. Yeah.
Any other comments or discussion, Commissioner? Thanks, I appreciate it. And I appreciate you taking a look at the applications panel, that report, just a fresh look at it, because I think maybe we can all be inspired by the services report update. Like we can improve. It's a healthy thing to be always improving the way we're understanding your operations, and we want, at least I want to make sure we're looking at reports that you also believe are valuable and are communicating the reality on the ground and helping the board make decisions. So, next we have vacancy. Ms. Goulet.
So for vacancy tonight, you have 3 departments with 8 position requests coming forward. And just to break that down, there are 7 positions that will come before you tonight that are already budgeted positions. The request is to fill those positions. As a reminder, the board continues to extend the ability that I have in situations where either less than a year or less than permanent appointment has occurred for an employee, so that those positions can be immediately filled. And I think departments continue to be grateful as the timeline associated with either civil service test results or canvassing processes and all those things can take a long time. Having that short period still allowed to use the original vacancy is very much appreciated. And then that'll be 7 that will be filled. That means they're outside that year period or outside that time period where a permanent appointment had been held. And there's 1 position to be considered at the Center of Public Health for abolish, create. So that being said, I'll invite Lindsay back up for 1 position they have. And as a reminder, it's a little trickier for us, and we've spent years refining the process for whether it's a social worker or whether it's a CASAC or whether it's a mental health counselor who's departing. To meet the need, the board created this behavioral health counselor environment. So I'll have Lindsay speak to that now.
Thank you. So this is a position within our child and family support team. This is a position that we receive state aid 100% for both of them for this team. So this is the clinician part of it. So this is a team that goes out and works with some of our highest risk, highest needs children that we have in the community. Kids that are at risk of hospitalization out of placement. Very, very well respected team, sought after team. So we are looking to build.
Questions? Thank you, Lindsay. Next up, we have public health. With Carly coming back up to speak to 3 positions.
First one is policy create. We're looking to abolish the keyword specialist position to create an administrative assistant position. This would be on our children's program side. So currently, we have set up, we have our supervising community health nurse, we have our senior service coordinator, service coordinators, secretary 1, and then the board question. So there are a couple of items that neither the secretary 1 nor the key question can work on. Because, you know, so things like contract, resolution, as well as the everyday administrative. And we have to be given to the administrative assistant. The biggest thing really for this now is because there's a change with the New York State building program that we're using. It's called Early Intervention Hub. So it was previously called NICE, now it's called the Early Intervention Hub. They're switching where it's right now where you can enter in documentation for the service coordinators, and they're moving to a program where the service coordinators need to enter to process the billing. So we're trying to, if we're able to have this position, give more of those administrative tasks. I can be a nurse, senior service coordinator, and service coordinator.
Questions? Next one is a fill for secretary 1 position.
So the position is vacant due to a promotion. We were able to promote our secretary administrative position.
Questions? Okay. And lastly, you senior.
So this one was also due to a promotion, unfortunately, they were promoted in this year. But we're hoping to be able to fill this one. This one in particular, we billing for some of the early intervention billing as well as
Questions?
Exactly what are the qualifications that the person you would hire to fill this position, the senior account clerk position, what are you looking for?
I believe it's required they either have an associate's degree in accounting or business administration. Or they can have a non-New York State regionally accredited college, and they have to have a number.
Well, yeah, those are that's the boilerplate of the qualifications, but what are you looking for in this person as far as background, work history, that kind of thing? What, or who would you not hire if they didn't have?
We definitely need someone with organizational skills.
What?
Organizational skills.
Yeah.
Is an absolute must. Attention to detail. Making sure that things are being filled out. Both for our clinic as well as receiving those in for our partners program. We aren't opposed to, someone coming out of school.
Mhm.
We're happy to kind of show them.
Do you have anybody on your staff now that you would hire in that position? No. So where are you going to advertise for applicants for this position?
Yeah, so typically we'll advertise on Facebook, Indeed, LinkedIn, Instagram.
But I would just comment, we have to exhaust the civil service list and canvas all those.
Is there a list?
I believe there is senior counselor, and I believe that test was also very recently given. Yeah, it was just given in February 10th.
So then advertising is a moot point.
After that's exhausted, it certainly is one of the options, but we have to exhaust those first. Build on that.
Thank you.
And Thank you, Carly. As Commissioner makes his way back up, I would just kind of echo what Carly talked about. In 2 of the vacancies you considered tonight, they are as a result of folks both moving up and moving across. And in the earlier report operations I gave you, we had 5 internal transfers. That means they didn't depart the county. That means they found either lateral positions or improved from their skill set to other departments within the county. So we're very excited. That's roughly 30% of the positions you're seeing this month. Another, I think, great example of what we're seeing in the workforce trends right now. Social services, first up, and if it's okay, there's no objection with the board. There are 2 similar positions. First 2 are caseworkers in CPF. The second 2 are social welfare examiners in TA and SNAP temporary assisted. If it's okay, I'll have him address each set of positions, and then if there's any questions, we can go through those. That sound reasonable? Okay, so first up, CPS caseworker.
Good evening again. We have these 2 caseworkers for CPS. Both individuals took lateral transfers to other caseworker positions. One moved over to the APS homeless unit, and the other moved into medical services, a caseworker position we had there. So they're staying here with us. You know, as you're well aware, we have an OCFS guideline of 15, a caseload of 15. We got a little above that recently, as recently as December, January. We've got it back down. That number, though, is kind of an interesting number because I have a number of staff that cannot take cases yet. It takes about 5 months for a caseworker from the time that they come on board, to the time that they can work independently with cases. So I got a bunch of other staff that have elevated caseloads, and a bunch of staff that have low caseloads. And we're seeing that start to even out. But filling these 2 positions, the sooner we can fill them, the better off we'll be in terms of staying ahead of the 8 ball. The CPS unit's been really working hard at taking care of things like overdues and keeping the cases moving through. They're doing a tremendous job of that. So that's the only reason we're seeing these caseloads come in under that 15 guideline that we have right now.
Mr. Forrest. Thank you, Mr. Chair. The term reassignment, is that new? We recall seeing that before.
That is an updated category when we are talking about handling social services positions.
So these are 2 CPS that are moving out of the CPS unit over laterally over to wherever. Probably because I know CPS is a challenge for a lot of people, more than likely. The shame in this is that one was there 1.5 years and the other was about 1 year. Looks like that they've gone through the training, they got to it, and then I'm sure the burnout factor kicks in as well. But yeah, I just don't remember seeing a reassignment.
No, and what we were finding, if I could explain a little bit on that, is those were, when there were movements within the department, you weren't seeing those vacancies. And so we don't handle any other department that way. And so when we recognized this was an issue, we wanted to make sure you saw those. And so while they may know these things are going to happen and they may be able to assist with the workload, we still think that gives you an accurate representation of the mobility within the department between CPS, which has an increased grade and a higher wage, and prevent. And there is quite a bit of that. And so we asked for them to bring those through so that you see it represented accurately.
So with that in mind, I would ask your indulgence in filling these 2 positions so that we can stay ahead of that 8 ball. And keep the train rolling in terms of getting these people trained and taking cases.
Any other questions on the CPS caseworkers? Okay, moving on then to the temporary assistance and SNAP vacancies for 2 social welfare examiners.
So these 2 vacancies, one of these individuals moved from TA SNAP to an examiner position in children's services, working on determining eligibility. And the other one was promoted to a senior social welfare examiner in TA SNAP. So again, you know, we're just keeping people inside the department. We talked a little bit briefly, we talked more about Medicaid than the others, but you know, we have several thousand individuals on SNAP and TA in the county. These individuals are continuing to not only work on the cases that they already have, but take additional cases as they come in. Each examiner right now It's got responsible for maintaining about 29 TA cases, and about 351 SNAP cases. It's a fast-paced, fast-moving environment. It really puts us behind the 8 ball when these individuals are out for any amount of time. I don't like that I have to ask to fill 2 positions at once, but it just kind of worked out that way. At least we're able to keep them in the department. But in terms of the eligibility and certifications and all of the things that they have to do, it's a big lift on the other staff members to have 2 vacancies at the same time. So I'm bringing them to you, asking permission to fill those 2 vacancies.
Questions? Okay, thank you, Commissioner. That concludes the vacancy review portion of the meeting.
Do talk to you, good report.
Okay, so a few updates for you. Wanted to let you know first that last Thursday, on March 14th, the New York State Board of Historic Preservation unanimously approved the application for 3 county-owned buildings. That's the courthouse that we're sitting in now, the circuit building on the corner, and the sheriff's house and the old jail as one location. Unanimously approved to be added to the New York State Historic Register. That will also move forward for the state to request that of the federal government. We should receive official notification soon, and of this meeting, there were 15 nominations from 12 counties. So I think there always seems to be an echo chamber surrounding what you'll be able to do with buildings if they're designated and the restrictions associated with this. The only portion of restriction is that I'm aware of, or that's been conveyed to us, is if you're going to use state grant funds, that all grant funds come with strings attached and reporting and reconciliation and reimbursement. That also is attached in that environment. Other than that, when you're using county funds, you can do as you wish. We will be starting, as a part of that update, our roof replacement project. This Friday, we'll be restricting access to the courtyard area, and they should be mobilizing as soon as next week, so long as not more of that white stuff continues to join us. So that is exciting news for about a 2.5-year to 3-year process. You'll recall we talked about it. This morning, EMS Director Denner hosted a meeting of the Solar Eclipse Planning Committee. Productive discussion happened with all the agencies that were involved between assets and availability of resources. So, confirming some things still need to be worked out, understanding where some of the needs are. Convening again next Monday. You're certainly welcome to join that meeting just to hear kind of the each agency report out what their plans are. Legislator Kern was able to join us today. We are planning to open the Emergency Operations Center. Counties are being tapped that have been through this before to provide insight. We will work on probably first thing that morning, but plan to open the EOC at 10 o'clock. Maintain operations, have representatives from agencies across the county and along the border to join us for about 2 hours after the eclipse. Provided there's no situations or areas that require a response, we'll shut that down along about 5:30 or 6 o'clock on April 8th. So that will be in this room. Certainly if you're available to assist, we would like to have you available to us. But we have also received the school updated list, which I'll share with all of you with the school's plans. I think many are planning to use their give back snow days on that day, which actually will extend the break, which is the week before, the 1st through the 5th, I believe. So that will give much less traffic on our roads for many of the school district and area. I want to offer our congratulations to the Hammond girls basketball team who captured their 2nd Class D title. As a reminder, Hammond merges with Morristown, so it's a celebration for Morristown as well. It does prove that sports mergers work and that it's possible to find success 2 years in a row for the Class D, that women or girls basketball team to win. We'd like to invite them to the May meeting, considering that the April board meeting falls during school's spring break. To invite them to the May meeting, I believe Legislator Sheridan will be back with us, who is the home district, to have them join us for the recognition and celebration that we've done for all the teams in the past. I met last week, as I mentioned to you, with BOCES with regards to communication. BOCES is in a very similar situation, as it turns out, that we are in their radio operations. For many years, they had an individual who managed the system and would update it as needed, and that person has long since gone. And so they're looking at what their options are, what businesses they should be in, EMS Director Denner was able to attend and present, which is the same presentation you've seen about the radio project that's expected to go live in the summer of 2025. And also talk with BOCES to get more information, whether or not it makes sense to bring that forward for the board to consider. Matt has considered the forethought of including enough room that if it was the board's decision to move forward, that there would be room on our system for BOCES. So we'll be talking through that, organizing what it should look like from a compensation standpoint, and if it makes sense to do that at this time. So you'll hear more on that in the coming months. Tomorrow we'll reconvene the group to plan the full-scale drill for active shooter that we're planning in the courthouse later this year. We have gained the ability for court security to join us, which is great relief, along with all of our agencies, Sheriff's Office, the state police, folks that will be joining us from across the county, forest rangers, everyone who's involved, Border Patrol, will be able to join us for that full-scale exercise. So we're excited to continue planning that effort. We are continuing to work. This agenda before you tonight was planned entirely in Civic Clerk. So we're moving forward, trying to get that ready for the rollout for you. Our hope is that you can log in and check yourself in as present as we move to utilizing this. Our hope is to have as little disruption as possible for your operations. I wanted to announce the availability of the position of Director of Human Resources. The chair and search committee have been appointed, chaired by Glenn Webster, Legislator Webster. That is posted now on our website. Our HR Director, Johnny Dorothy, has moved into the Personnel Officer role, and we will accept applications through April 5th to be considered by the search committee with the recommendation to come forward following candidates, review of the candidates. Also convened the Public Health Search Committee last week to begin narrowing the field of 17 down to around 7 or 8. The search committee is agreeable to conduct some interviews. Some have submitted their applications from great distances to potentially interview them via Zoom or electronically the first round, with full expectation that the narrowed group would attend in person. I have asked for consideration and been agreed to conduct much like we did when we hired a social services commissioner, a similar model to what the school districts employ, having our final couple or few candidates come before the staff. I will solicit questions from the staff as well as ask my own, and then take feedback from the staff that I can provide back to the search committee. So that seems to be and yield a great opportunity for staff to be involved in the recruitment process and also in the final recommendation made to the board. Questions? And the last item I'll mention is I will be sending out, and include you in it as well, updated parking maps. As I mentioned, we're going to be shutting down the courtyard, relocating parking to the exterior lot. As you know, we've pushed all the fleet cars out to Human Services Center, and so that you can see the maps where temporary parking, where unrestricted parking is now available, where we did have reserved for fleet cars, so that you can help navigate when you come to the complex, any of the complexes here in Canton. Thank you.
Next, we'll move on to committee reports, starting with Legislator Curran for Board of Health.
Thank you, Mr. Chair. So the February 20th meeting did talk about the countywide smoking policy. That was something that we had sent stuff back to Ruth, and I think Ruth, where it is now, is it's gone back to the county attorney for clarification still.
I think there were a couple other items, if I recall, talking with Carly about that the Board of Health is going to take a look at. Finalize, a couple members still had to provide their input,
Right.
and then yes.
And we looked at what Wayne County did, what Cattaraugus County did, what Nassau County adopted. We're still in process on that. We are doing a resolution proclaiming May as Lyme and tick-borne disease awareness month. You know about that. And then just the status of seniors we talked about with Maplewood shutting down their program. It's concerning about what we're gonna do with the elders and the people that are involved in that program. There's supportive housing will be shutting down at some point. It's 250 beds. So we're gonna have to figure out what happens with those people. And Dr. Terrence noted that there's like no specific geriatric providers in the community that just do geriatric medicine. It's a large stretch in a place where our seniors are already strapped to find services, and so that's something that we're tracking. We'll be talking more about. And then Mark Devers gave a report on the EMS problems in the county. I'm sure that we could get those slides first. I'm sure we could get those slides and share with you. I'll send them to you in your email. Any questions?
Thank you. Sir.
Thank you.
CDP Board of Directors, Mr. Burke.
CVP board meets this Wednesday.
Sounds good. Legislator Haggard with Community Services Board.
The board met on March 5th. They had a presentation by Seaway Valley Prevention Council of needs assessment, as well as a discussion on the use of or the RFP for the opioid settlement fund. They did not have a quorum, so this was a meeting, and the next meeting is on April 2nd.
Thank you. Any questions for Legislator Haggard? Okay, Legislator Denisha, Office for the Aging Advisory Board.
Mr. Chair, Office for the Aging, we have not met since my last report. Meeting is Monday, April 8th, 10 a.m. Hopefully, see a way to get there.
Thank you, sir. Any questions from Mr. Denisha? Legislator Tremonelli is excused from the meeting. Does anyone did she share her report with anyone? Okay, now we'll hear next time from her. Is there any old business here today worth? Is there any new business? Mr. Smithers.
Yes. I have to say, if we're gonna task county administrator with a desire to add additional personnel, particularly management, then should also be accompanied with a recommendation of how to fund these positions. I think in the nearly 4 years I've been here, Ruth has presented a reasonable budget every year. Costs are going up. We've added positions. She's justified the need for those. I'm just one of 15. I've had some doubts about lowering the true value tax rate, which we've done every year. We've added many positions, 20 some this year. And sales tax revenue, which is a large part of our income, is very questionable. So I'm very hesitant to task her with telling her that we need more positions. I think that's her job to, if there's a need there, to bring it to us.
Any discussion on this comment? Well, do you want to speak to that? Okay. Any other, Mr. Burke?
I should have asked Rita when she gave the report, but is there any need for the board to take action regarding the completion of services for geriatric population?
Ms. Grant, you want to address that?
That was a discussion. We at some point are gonna get a report. We should get a report. The county should get some information as to exactly what that looks like. How many people are there now? How many people are gonna have to be displaced throughout our community? How many people are going without, not without services, but within their own company? You know, are they gonna move 50 people to this facility and 25 to that one? What is their plan? And they're supposed to give both the state and I believe the county a timeline on their shutdown. And then what does that mean in terms of services for the county? That's kind of why it's early. You know, they have a while before they're gonna be, I believe it's like more than 6 months that they have to go through this process. But it would be interesting to see, our meeting is tomorrow night. What other data that we've gotten together and what does it mean? And one of the things that we talked about is, you know, if the people who do this as a business leave and the numbers keep dwindling, at what point does the county become the provider of last resort for some? So.
Mr. Burke, do you want to follow up? And then Ms. Haggard.
Just a quick follow-up, wondering, and really, you probably wouldn't have. How other counties have maintained their services of water. And I'm wondering. Between Jefferson County and St. Louis. Is it a business model or other factors?
What the payers.
Is that different for Jefferson County? What it is?
There's a difference in who's paying for the care. You know, at a certain point, if somebody has to go into care that is paid for, do you have insurance that covers it? Do you have an insurance plan that you paid ahead of time that covers it? Is it Medicare? And you have a secondary insurance from your retirement that covers it? Or is it straight Medicaid? And I think if we look very closely, we'll find that in this county, a lot of our elderly that end up in those situations are straight Medicaid. And there's a formula where the governor's office or the state tells us basically how much we fall behind every month with those payments. It's certainly not enough to provide the service.
You know, just wonder if there's any indication for us to take any kind of action before before we have no. I mean, I know we've got a couple of places over.
Ms. Haggard?
Thank you, Mr. Chair.
Sure. Mr. Reagan, did you have a comment on the conversation regarding Board of Health?
Yeah, just two
And then we'll
comments.
go to
One,
Ms. Haggard.
the United Helpers would have had to file a plan with the New York State Department of Health before they could announce their closure. So if we're interested, we might want to ask for the report. I think that if we look further, we'll also find that there's been a trend of nursing homes across the state closing, not all in 1 year, but 1 or 2 a year in different places, because no one talks about this, but New York State has an unwritten plan to close the nursing homes in New York State. And because they cost money. And so what they do is, instead of closing the nursing homes, they starve them for funds. And they do not increase their reimbursement rate. And they have been asked to increase their reimbursement rate. Their state association has repeatedly pleaded with state officials saying, we cannot continue to provide these basic services with the amount of money that we are receiving. And at the same time that the state is refusing to increase reimbursement rates, the state has added more and more rules on what they are to do and how they are to do it. Inc. required them to increase the wages that they pay and added where they at one time had what were people who were volunteers for the Office of the Aging who you know, went into the nursing homes and helped intervene for the patients with the staff and let them know when there were problems. That has now become a state agency whose job is to go and nail the agencies, the nursing homes, and then prosecute them with the former Governor Cuomo's justice agency, whose job it is to harass and prosecute the nursing home administrators and other agencies, other groups. So, you know, whenever, the more you regulate, the more you refuse to provide funding for, the more we will see nursing homes closing and they will be left for people and families to deal with. And that's my own opinion of what we're seeing happening.
All right, back to you, Legislator Haggard, with the advisory report.
Thank you, Mr. Chair. The next Youth Advisory Board meeting is on Thursday, April 9th at 5:30 p.m. Our youth committee met on Sunday, March 10th. Jen Sloan with Public Health came and spoke with the ambassadors about the Children and Youth with Special Health Care Needs program. Ambassadors were helpful in offering feedback about where they think the schools needs are in providing accommodations. Ambassadors also started planning their showcase video as their wrap up with youth as solutions and 5-hour free Friday. Their April meeting is a virtual one on Sunday, April 14th at 4 p.m. We recently welcomed 4 new ambassadors to the youth committee. Our 4th annual Trash Dash is scheduled for April 27th and 28th. Details and registration will be announced soon. Tomorrow, we welcome motivational speaker Adam F.C. Fletcher from Oregon, who will offer a 4-hour workshop on modern youth leadership to 20 adults who work with youth in St. Lawrence County. We thank the Association of New York State Youth Bureaus for providing funds to offer this training opportunity. That concludes this termination.
Thank you. I will ask questions because you probably don't know the answers.
Please don't.
Is there any, well, I'll go back to new business. Now if you close it up, is there any other new business this evening? Okay, Mrs. Doyle, is there a need to enter executive session?
There is for litigation, negotiations, personnel, which is the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and 1 appointment.
Is there a motion to enter executive? Mr. Forsythe, seconded by Mr. Jeanette.
Yeah.
In other forms.
You were able to get the closest, town historian, but Nancy, a favor, she was able to locate the closest, thing to the chart.
All right, back on line. Mr. Dean, you had one last commendation you wanted to share?
Yes, thank you, Mr. Chair. Want to publicly thank our St. Lawrence County historian, Nancy LaFavor. During the, obviously with the time that the town of Herman is going through, needed to find the town charter. And the town charter, the town clerk in Herman did not have it, the town historian in Herman did not have it. I had bits and pieces. And but Nancy, said she would do some digging, and she came up with what was close to a charter as we were going to. So I just want to, on behalf of myself and the town of Herman, want to thank her for this.
That's great. Seeing no further business, is there a motion to adjourn? Is current seconded by Mr. Perkins. All in favor?
Aye.
Aye.